Hello. Good afternoon, students. I hope am I audible to everybody?
Yes, sir.
Thank you. I think you can see that my topic on the screen, no?
Yes,
Now
sir.
today's scheduled, which is on amputation, which is supposed to be taken by Dr. Ashish, is postponed till 29th. The topic today, which I'm going to speak, is about special therapies and alternative therapies. Now, what is therapy? Let's see, how do you define therapy? Therapy is also called a treatment of someone with mental or physical illness without the use of medicines, drugs, or surgeries. Now, when you say special therapies, it usually refers to special treatment for those patients with special needs, or we can call them physically or mentally challenged. Now, what comes to my mind when we talk about special therapy is the word rehabilitation. What is rehabilitation? Rehabilitation is restoring someone after an illness or disease to an optimal health or a normal life through training and therapy. If you look up from this picture, you can see who are those people who require special therapies. Look at a child who is physically challenged, he requires physical therapy. A geriatric case who is bedridden, she also requires special therapy. A person who is amputated, and a person who works with assistive device like a cane, a crutch, for example, they all require special therapies. Now, some of these persons with disabilities, cerebral palsy, disorders of movement and posture, arthrogryposis multiplex congenita, which is a disorders of the joints, autism, learning dysfunctions, post-stroke paralysis, head injuries, spinal cord injuries, amputations, post-birth contractures, or hearing, speech, visual impairments, post-traumatic disabilities, and so many others. Now, according to UNCRPD, that is United Nations Convention on the Rights of Persons with Disabilities, they define rehabilitation as the appropriate measures, including peer support to enable persons with disabilities to attain and maintain their maximum independence, full physical, mental, social, and vocational ability with full inclusion and participation in all aspects of life. You please do just listen to me. I mean, no need to write down because you won't get time to write down. Now, Rehab Team comprised of physicians, physical medicine rehabilitation, or any specialist, for example, a pediatrician or an orthopedic specialist, a neurosurgeon, a clinical psychologist, physiotherapist, occupational therapist, speech therapist, prosthetics and orthotics, medical social worker, rehabilitation therapists, nurses, counselors. Now, what is physiotherapy? Physiotherapy, it helps to restore the movement and functions when someone is affected by an injury, illness, or a disability through exercise therapy, manual therapy, electrotherapy, which we can see in our physiotherapy unit. They have the ultrasounds, the shortwave diathermy, the microwave diathermy, interferential therapy, transelectrical nerve stimulation, electrical stimulation, tractions, etc. Now, occupational therapy, they deal with assessment and intervention. They develop and recover or maintain the meaningful activities. Occupational therapy treatment focus on helping people with physical, sensory, or cognitive ailments or disability to be as independent as possible and to achieve maximum functional independence. Now, some of these therapies, other than the usual counseling, educations on the do's and don'ts, the range of motion exercises, which can be active, passive, active assistive or resistive exercise, strengthening exercises with weights, therapeuts, bands, machines, and stretching exercises. There are other special therapies like the Neurodevelopmental Therapy, sensory integrations, proprioceptive neuromuscular facilitation, perceptual cognitive training, gait training, activities of daily living training, architectural modification, assistive technology. Now, our aims and objective of these special therapies is to maintain or increase the joint range of motions and muscle strength, is prevent contractures or any deformities, encourage functional abilities, activities of daily living independence, that is to make them independent as possible, whether it is self-care activities, for example, feeding, drinking, combing, bathing, toileting, etc. Communications, that is ability to read and write. Mobility, that is indoor mobility or outdoor mobility. And other aims and objectives, that is psychological upliftment, social vocational integration, and overall is to improve the quality of life irrespective of the conditions or disease, irrespective of the age or sex. Now, what is neurodevelopmental therapy? Neurodevelopmental therapy is a hands-on client-centered approach that seeks to improve gross motor functions in children and adults with neurological problems such as cerebral palsy, which is very common, and thereby to improve the independence in a variety of contexts. Neurodevelopmental therapy is based on the developmental milestones. Now you see from the picture a boy whose aim and objective is we want to achieve crawling. So what we do, we put a bolsters behind, we stabilize the hip and encourage, we roll the child up forward, backward, that will encourage crawling. And second, if you see this boy who wants to achieve a balance in standing and sitting, well, we put him in the physio ball and we rotate the ball left side, right side, forward, backward. At the same time, we stabilize the hip, and also we at the same time we give them some activities so as to get their attention. Now, this is just an example of what neurodevelopmental therapy is. Second, sensory integrations. It is a form of occupational therapy which involves a specific sensory activities to help a child appropriately respond to sensory inputs. Example can be a sensation with touch, light, sound, smells, and other inputs. Now, this is a sensory integration setup, which we have different kinds of equipments, like for example, if you want to achieve a vestibular, this is what we call to achieve a vestibular balance. We put the child in this, and then we, like a hammock, we move the child upward, forward, backward, sideways. And sensory integration, which is also, there is another approach called the proprioceptive neuromuscular facilitation. So we have activities of daily living training. Now, this is ADL training in short form we call. We have different kind of ADL board. For example, the door latch frame with different kinds of shapes. Like, for example, we have these multi-shape pegboards. We have these 5 pegboards. We have shoulder abduction ladder. Now, for example, this shoulder abduction ladder, if you want to achieve a shoulder flexion, that is, we teach them to do this shoulder abduction ladder so that this will incorporate in their day-to-day activities whenever a person wants to pick up anything from overhead. So these ADL activities, we give them training such that suppose if they be able to do these in the board, they will incorporate in their day-to-day functional activities. Now, perceptual cognitive training for those patients who have a perceptual deficits or a cognitive deficits who doesn't understand the size, the shapes. So these are different activities. For example, we have these triangular, circular, and these pegs with different colors and different size, puzzles, etc. Now, there is another what we call equipment-based exercise therapy, which we have here in our unit, different types of equipments. And some of these is a physio ball, the TheraBands, we have the TheraTubes, we have the Flex Bar, Weber, the Therapeutic, and there are different ways. We have to teach them different ways of doing the ball exercises. Now, if you give a ball to a patient, he will not know how to do it. Now you have to teach. There are differences. Like, for example, if these are different grabs. This is cylindrical grabs. This is a tripod. This is a hook grabs. So accordingly, we have to teach them so that they can incorporate in their functional activities. For example, lateral grabs will be required in opening and closing a key, and tripod will be required in eating and writing, etc. Now, assistive technology. What is assistive technology? Any item, a piece of equipment or a product system, whether acquired or commercially off the shelf, modified or customized, that is used to ease performance, increase the functional capabilities and improve the quality of life. Now look at this boy. This is an elbow crutch. That is an assistive technology. Spectacles, that is also an assistive technology, for example. Now, adaptive devices is also part of assistive technology. Devices which is used to assist with completing activities of daily living. For example, bathing, dressing, grooming, toileting, feeding. These are all self-care activities. And what are these adaptive devices? Example, the modified feeding devices, where a patient who is not be able to grip. These are these are modified writing device. This is a modified spoon, modified combing device. This is a button holder. This is a reacher. This is just, for example, for those patients who are paralyzed, who cannot be able to do any grabs apprehension. Simply is just a push to open. This is also type of an assistive technology. For example, this boy who is having a speech impairment, he just uses these on a computer. For example, a patient who cannot grab, so we can modify the handles in such that the patient can hold it properly. And these are just assistive adaptive device for those patients who cannot stand or sit with a good balance. Now, assistive device, it can be defined as a device that helps someone do something that might not otherwise be able to do. Now, these will help them be independent. Otherwise, without this device, they might be dependent on others. So, generally the term is used for devices that help people to overcome a handicap such as mobility, vision, mental dexterity, or a hearing loss. Now, if you see, these are all assistive device. This is the elbow crutch. This is axillary crutch. This is simple cane, and this is a walker. Now, the cane also, we have different types of modifications according to the needs and according to the patient's ability. We advise them. Like, for example, this one will give more stability for those patients who is having a very poor balance. Now, walker also has got a different types. This with an increased size, for example, for those who is obese. This is a standard. It can be folded according to the height, and this with a tire in the front, so we'll be able to assist the users. And this is with a utility card. They can also perform any activities with the walker. Now, this is a reverse walker, which helps a patient, especially in the pediatrics case, that is a child who can move, who can propel forward without any obstructions from in the front, a reverse walker. Now, wheelchair also, there are different types of wheelchair. It can be fixed, folding, depending on size. It can be adults, pediatrics. It can be solid motorized or computerized. Now, this is a standard wheelchair which can be folded. The armrest can be detachable. The leg rest can also be detachable. The casters can have a different size according to the terrain or the surface. The handrail also can be modified. It can be modified such that in order to meet the patient's ability. Now, this is usually seen in sports, and it can be adjusted in height. These are specialized height technology wheelchair, which you can fold the leg rest, you can fold the back rest. Now, this is a voice controlled wheelchairs which can easily controlled by the speech voice, and this is a joystick wheelchair where you can easily adjust with a stick, forward, backward, sideways. Now, coming back to speech therapy, they usually deals with the language and communication problems. So speech therapy, they deal with this language and communication problems, that is maybe the problems with understanding language, expressing thoughts, or responding in the social situations. They also deal with those who have a swallowing or feeding problems. Now, prosthetics and orthotics, they are those professionals who deals with artificial limbs, that also called the prostheses, for those people with amputations. They also make supportive devices, also called the orthoses, for those with musculoskeletal weakness or neurological disorders. They also fabricate splints. The artificial limbs can be above elbow or below elbow prostheses, above knee or below knee prostheses, and orthoses can be a hip, knee, ankle, foot orthoses, or a knee, ankle, foot orthoses, or an ankle, simply an ankle, foot orthosis. Some of these, for example, this is a below knee amputation, which requires a below knee prosthesis. This is a myoelectric prosthesis, and this is an amputation on the fingers. You put the cosmetic glove. So the prosthetists and orthotists are those professionals who deals with all these supportive devices. Splints, what is a splint? A splint is a device which is used for support or immobilization of a limb or a spine. It can be used in multiple situations, including temporary immobilization of potentially broken bones or a damaged joint and support for a joint's during activities. Now, for example, this is a cock-up splint. For conditions like tenosynovitis, for example, or a wrist sprain. This is an ankle-foot orthosis, which is usually given for those with foot drop deformities. Now, coming back to other alternative therapies, which usually refers to a health treatment other than medicine, or otherwise can be considered as a complementary treatment. Now, alternative therapy can be homeopathy, Ayurvedic, Chiropractic, Acupressure, or Acupuncture. All these branch can be clubbed what we call the naturopathy. It is a broad branch of alternative medicine, holistic approach of therapy by stimulating a body self-healing mechanism and exploring its mental, physical, and spiritual manifestation in a given patient. Naturopathy typically involves a variety of treatment technique, which includes nutrition, behavioral changes, herbal medicine, homeopathy, hydrotherapy, acupuncture. Now, acupressure is similar to the acupuncture. This is a traditional Chinese treatment where in acupressure, no needles are involved, unlike in an acupuncture where the needles are involved. Now, the practitioners here, they use their hands, their elbows, and feet to apply pressure to a specific points in the body. Now, we believe there are some specific points in the hands which have an effect on other parts of the body. Now, the principles of these is like that these trigger points, if you put the pressure, they will promote the release of the natural pain relieving chemicals in the body, that is the endorphins. Another theory is that this pressure may somehow influence the autonomic nervous system. Studies have shown that these alternative therapy it has a beneficial effects on these cancer-related fatigue, stress, headache, muscle stress, tension, strain, cramps, neuromuscular diseases, migraines, or even in stress management. Now, acupuncture is similar to the acupressure, as I said, but here the needles they are involved. These give biochemical changes. These biochemical changes in the body may stimulate the body's natural healing abilities, which can promote physical and emotional well-being. Now, there is another alternative therapy which we call aromatherapy. Here, it is a holistic treatment that uses essential oils, highly concentrated extracts from the roots, the leaves, the seeds, or a blossom from plants to promote healing. It can be inhaled or diluted in a carrier oil and massaged into the skin. They promote physical, mental healing and well-being. They can also treat inflammations or infections. Now, Ayurvedic, a very popular treatment nowadays, you see this modality is originated in India and has been around for thousands of years. They use a variety of techniques, combined products mainly derived from plants, but may include animals, metals, minerals, diet, exercise, massage, with the intent of balancing the body, mind, and spirit to promote the overall wellness. Now, yoga. Yoga, these are a set of specific exercises called poses, is combined with the specific breathing techniques and meditation principles. It addresses a range of physical and mental issues. Now we come to hydrotherapy. Hydrotherapy is a use of water, both internally and externally, and at varying temperatures for therapeutic purposes, also known as water therapy or a water cures. Hydrotherapy includes such therapeutic treatments such as saunas, steam baths, foot baths. Usually you'll find in those health setup in a gym, a contrast therapy, and sitz baths. Now, principles of hydrotherapy works that hot water causes superficial blood vessels to dilate, which in turn activate the sweat glands, so it loosening the joints and remove those toxic waste from the tissues. While the cold water, it causes the superficial blood vessels to constrict, moving the blood flow away from the affected area to relieve inflammations. These are just some pictures of hydrotherapy. Now, homeopathy. Homeopathy is an alternative therapeutic practice that was developed in the late 70s. The principle is that there's a substance that causes symptoms in a healthy person can be used in a diluted form to treat symptoms and any illnesses. They use pills which are made from inert substances, often sugars, typically lactose, upon which a drop of liquid homeopathic preparation is placed and allowed to evaporate. Now, lastly, we have this chiropractic, which is popular nowadays. The practice is they focus on this musculoskeletal and the nervous systems. The most common procedure performed by chiropractors is spinal manipulations. Chiropractic adjustments are intended to restore the mobility, loosen the muscles, and allow the tissues to heal and the pain to resolve. So these are some of those alternative therapies, and I hope that you understand some of these. So anyway, if you have any questions, you can either chat or you can give your verbal communication. Thank you.
Thank you, sir.
Yeah, thank you.
Thank you, sir.
Yeah, thank you. Thank you.